Good morning, Dr. Shorab. Nice to see you here. We welcome you to the IADA Caribbean section webinars. And this is our local or regional seventh webinar that we're taking place. And we are happy to have you here. And please share your words. And I would like to introduce you to the participants in a couple of minutes after your words.
Hello, hi. Thank you very much, Prof. Santosh, for inviting me to do this presentation on the work I'm doing here at James Cook University, especially in terms of developing health systems and helping developing countries improve their healthcare, particularly in my specialty, which is periodontal healthcare. And unfortunately, this resource is not available in many countries. So, but thank you. And if you can go ahead and do the presentation, and I'm ready to take any questions or any queries, either verbally or even by email, that will be shared with you at the end of the presentation. Thanks, Prof.
Thank you, Dr. Shorab. So, colleagues and friends and participants, today we have Dr. Mohammed Shorab. He's a senior lecturer currently serving at the Division of Tropical Health and Medicine, James Cook University, Queensland, Australia. He's also an external supervisor-PhD, Division of Tropical Health and Medicine, James Cook University. He's the president of Oral Health Scientific Group or Network of International Association for Dental Research. He is also serving as a review editor in Frontiers in Oral Health and also reviewer of Pacific Health Dialogue. So today, he is going to highlight us with the presentation, the title, Research on Promoting Oral or Periodontal Healthcare by Identifying the Gaps in Dental Healthcare Systems in Our Geographical Location. The presentation will start in next couple of few seconds.
Hello, hi, I'm Dr. Shorab. I'm the periodontist over here at this clinic, as well as a researcher at James Cook University and a senior lecturer. And I would like to do a presentation, and I would like to thank Professor Santosh for inviting me to do this presentation to the IADA Caribbean session. So let's commence on the presentation, and I'll get the share screen ready, and let's get on to it. Thanks. So what we have is my presentation. Let's make a start. Okay. So basically, I'd like to introduce myself, and basically I'm Mohammed Shorab, and I'm from Fiji originally, and spending time both with civilian streets as well as military in Fiji, providing dental services, and also spent time in New Zealand for 27 odd years, where I studied at Otago University as well as in Auckland. And I'm the current president of the ERL Scientific Group Network of the International Association of Dental Research, and also senior lecturer at the College of Medicine and Dentistry at James Cook University, and also, as I said earlier, researcher at the College of Public Health, Medical and Veterinary Sciences at James Cook University, based here in Townsville, Queensland. So Professor Santosh had requested me to do a presentation based on my research work, which is basically in health system strengthening to identify gaps, especially in relationship to my specialty, which is periodontal healthcare, and my work in relationship to capacity building for healthy society in developing countries. So let's make a start. And first of all, I would like to declare that there are no conflicts of interest or financial gain in relation to this presentation. Now, I'd like to allude you to this United Nations Sustainable Development Goals of 2030 and bring to your attention some important points which the UN have brought up. And basically, it's to do with good health and well-being, also reducing inequalities, not only nationally, but also internationally, and all goals of 2030, and bring to your attention some important points which the UN have brought up. And basically, it's to do with good health and well-being, also reducing inequalities, not only nationally, but also internationally, and also the partnerships to achieve the goals. So the importance of communication and collaboration is very, very important, not only within the national systems, but also internationally through academic institutions as well as clinical institutions to achieve the common goal of to achieve good health and well-being for everybody. And the 6 core functions of the World Health Organization, which I have listed here, basically to promote development, and obviously more to do with health development, and also strengthening health systems, and then harnessing the research that's available so that there's evidence-based information available, and enhancing partnerships. Now, this is very, very important, both at a national and international level, so that we support each other for the common goal of achieving health for all. And this requires dialogue, developing relationships, and communicating and collaborating in various activities. So the 6 building blocks for a health system has been provided by the WHO, which is basically largely to do with leadership and governance, which is at the core or the center of those 5 other activities which are essential for a health system. So basically, leadership and governance has to be very good in terms of being able to get the necessary resources and be able to mobilize and activate the systems for a better health for the community. And many a time, each one of those you'll find has difficulties. So service delivery, for example, if you don't have human resources, then how will you deliver services? So in some countries, service delivery could also mean that the clinician needs to travel from one island to another island through inclement weather and all these difficulties, whether they're able to achieve it or not. So to be able to provide the resources to everyone, it becomes very hard. And then the availability of information in various countries is not the very best because of lack of resources, communication issues, and all the difficulties that come with it. And of course, if there's no finance, then many of these things are unable to be achieved. But obviously, there are funding organizations that try and help out in the process to improve health for people, both what you call in government as well as private enterprises. And of course, human resources is a major problem because the lack of expertise to be able to provide various services to the community. And of course, there are problems with availability of various medicines and various technologies to various parts. But do note that all these things are an evolving and very dynamic scenario, and it requires constant surveillance, planning, and actually it's an ongoing cycle, but requires constant attention and dedication on the part of healthcare workers in general. So just to allude you to this meeting, which was held on the 18th of November 2019 by the Pan American Health Organization, as well as the World Health Organization, where they hosted a meeting of the Caribbean countries. And this was basically the funding from the European Union. And there's a grant, and basically it was to ensure that there was health system strengthening for universal health coverage partnership. And this was agreed between the WHO and EU. And this is for all countries in the Africa, Caribbean, and the Pacific. Now, and it was noted that there was fragmentation and segmentation of health systems, meaning that people are not receiving the integrated comprehensive care that they desperately need. So in order to try and address the fragmentation, this requires communication, collaboration, diplomacy, and relationship building between institutions and nations, as well as organizations. And the whole idea is to try and strengthen the health system to address various diseases. Now, there was another meeting a couple of months ago on the 25th of October, 2022, and this is the report that was released by the World Bank. And basically, there were delegates from 7 Caribbean countries, which they gathered in Castries in St. Lucia. And basically, it was to discuss the policy reforms and share insights at a Caribbean flagship regional knowledge exchange. And this is following the disruptions caused not only in Caribbean, but also globally by the COVID-19 pandemic. And the good thing is that the Caribbean countries have prioritized strengthening the control of non-communicable diseases, improving the health hospital sector, and the health information systems, so that there's accessible information between various organizations, as well as the various Caribbean countries to support each other. And hopefully, on a more global level, they're also supporting each other globally. Now, but what it is emphasized is creating a platform for dialogue and collaboration. Now, in order to achieve that, a team effort is required, both nationally and internationally, to achieve this. But some areas that need addressing in the Caribbean are basically the health system and the infrastructure challenges. And this applies to most developing countries where their resources are limited and infrastructure may not be the very best. And of course, the lack of what you call skilled health professionals, which is a chronic problem in most developing countries. And with some improvement in healthcare, obviously the population is aging, and obviously there's more chronic disease, and of course there are financial vulnerabilities. Now, the good thing is that the Caribbean has got a Caribbean Training and Education Center for Health, which is based in Jamaica, and its vision is to build resilient health systems, and in order to provide high quality health services and improve health outcomes for all the Caribbean people. And it does monitor and evaluate the performance of the health system and identifies gaps and challenges. And it's finding sustainable solutions to collaborating with a strong network of stakeholders. And this should be not only just within the Caribbean, but around the world of whoever can help, especially with communications nowadays. And this presentation is one of those where we can communicate and help each other out in healthcare delivery systems. Now, this is basically introducing my background and my research work, and basically it is to do with building capacity. Now, one of the biggest problems we have, excuse me, in the Pacific is lack of periodontists. So I was approached in terms of what I could do to help build this clinical capacity. So just to give a bit of a background about this project that I'm involved with. And there was a meeting of heads of the dental services of the Pacific Island countries in Fiji. And this was organized by the head of dentistry at the Fiji National University. And apparently she and the team had identified the increased prevalence of periodontal disease in the Pacific Island communities and the lack of clinical capacity in effectively managing it. So she invited me to do a keynote speech on periodontal disease surveillance and care in the South Pacific. And I attended, and I was also the external examiner at the time. But I'll tell you one thing, that when presentations are made, and there's a lot of diplomacy, and many a time you don't allude to the negativities or the difficulties that people encounter in these countries, and everyone wants to elaborate on all the good things. And so that those gaps and difficulties are sometimes overlooked. But at tea time, or what in the Fijian terminology is called talanoa, which is basically discussion, then it's an informal discussion over a cup of tea or a cup of coffee. And then the truth starts coming out in terms of what's happening. And one of the simple problems that have been isolated have been a very limited or lack of manpower resources in the Pacific. And of course, a serious lack of periodontists or dental specialists involved in periodontal clinical care. And the good thing is they also come up with some solutions. And when I asked them, so what do you think is the way to handle this? And this is where the Chief Dental Officer in Tonga, King of Tonga, he is one of the leaders in the Pacific in terms of dentistry, Dr. Amanaki Pakakovi. And what he said, why don't we help train the dentists locally to manage periodontal disease as part of an in-service training and primary healthcare project? So we gave this some thought to see how we could achieve this. So we pondered about this whole idea and just had some discussions between us. How could we achieve this? And in discussions with Professor Peter Leggett, who is the Deputy Dean at the College of Public Health, as well as part of the Anton Brown Institute for Research Center for Health System Strengthening at James Cook University, we came up with, I think this should be thoroughly studied and critiqued and investigated, so we get an evidence-based information to be able to help not only the Kingdom of Tonga, but other developing countries as well. So this is where we started developing a PhD level research project to be able to then work out how can we best help the country, and the Kingdom of Tonga was a good place to be able to achieve this project. And basically, the research project was titled Building Clinical Capacity for Periodontal Disease Management in the Kingdom of Tonga. But this required constant liaison and collaboration and communication with the team in Tonga, basically Dr. Amanaki and Dr. Fita, who was the principal dental officer as well as other advisors. And it's a team effort, and everyone has their say and their input in the whole thing, and you come up with some very good ideas. So it's not an individual effort, but a combined team effort. So just a quick brief, and I'm sure most of you know about this. The periodontal diseases or periodontitis is caused by bacterial infection in a susceptible patient. And it is a destructive disease, usually seen as bleeding gums or pus or bad breath or loose teeth. But it's largely due to the destruction of the jawbone or maxillomandible with support teeth. So it is reality, a systemic infection where the bone is being destroyed. Now, for some reason, I don't know why, that many times people think that the mouth is divorced from the body, when in reality, it is a part of the human being. Okay, so it's the same bone as a bone elsewhere. The only difference being that the maxillomandible is susceptible to, in the presence of teeth, is susceptible to destruction. So it's compared to, say, arthritis, for example, where arthritis is very painful, but there's no real loss of bone as such. Whereas in periodontitis, you end up with bone loss, which is a significant disease. And then the systemic effects of this in terms of cardiovascular issues, as well as what you call cerebrovascular problems. And it is of serious concern that needs addressing, but unfortunately, the resources aren't available to be able to provide this service in many countries. And it has been noted as severe periodontitis is one of the 6 most prevalent diseases globally. And periodontal disease affects more than half the world's population, some way or the other. And also one of the most common reasons why teeth are lost. So now, basically, just seeing the general distribution of periodontal disease globally, it affects 11.2%. Now, this really depends on the type of examination method used to assess this, and I'll later allude to that in this presentation. But based on whatever method was used, the assumption was, or findings were, that it was 8% of the Asian Pacific population, and similarly, not too different is the Caribbean at 8.6% of the population have been affected. But based on the system, it is a lot more than that. It really depends on what method was used to assess periodontal disease in the population. But what we did find out is in Tonga that there's a very high prevalence of missing teeth in adults over the age of 45 years. And there's a rapid increase in the rate of demonstrations after 40 years of age. And this is largely due to the long-term presence of periodontitis. And it is evident from a very young age. Now, assessment systems in determining periodontal disease is also very important because, like in the USA, a study that done from 2009-2010 and reported that it was found that 47.2%, which is close to half the population of the US, is suffering from this condition. Whereas, but this was using a full mouth attachment level chart, whereas when the CPI-10 or the Community Periodontal Index for Treatment Needs chart was used, only 27% of the population was suffering. So systems of assessment are critical in terms of determining prevalences, because that also determines, when you're communicating with public policymakers, health policy, what information are providing them. Now, 47.2% or 50% of the population is a lot more serious than, say, 27% of the population. So it's critical that this is brought to attention when assessing disease prevalences. And what you call, when a full mouth attachment level child is in the call-out district in India, 72.9% is close to 73%, which is a very high prevalence of periodontal disease in this particular population. And similarly, about the same amount in the Philippines. But that was using the CPI-10. So if you used the the full mouth attachment, that will be a lot worse than what the CPATN is provided. Now, the Kingdom of Tonga is obviously in the South Pacific, and as you can see that there's a black arrow pointing to Tonga. It's one of the island countries that form the Pacific Island Group, often referred to as the Blue Continent, meaning the sea. And Tonga itself is made up of a number of islands. And the main island is Tongatapu, and the capital city of Tonga is Nuku'alofa. So it is a population of about 107,000 distributed. The main population is sitting in Tongatapu, the main island, where there's about 10 dentists. There are 2 dentists in 2 other islands providing services to the region. But as you can see, if you look at the left where you see the island distribution, so water or the sea creates geo-isolation and difficulties and constant weather changes. I think similar to what happened in the Caribbean in terms of cyclones and storms create a lot of difficulties in healthcare delivery systems. But the good thing is here in what you call this region, that Australia and New Zealand provide a lot of support. And just as I'm sure that the US and other neighboring countries provide support to the Caribbean countries. So there's a definite lack of periodontists, as I mentioned earlier. There's dentists, but no periodontists, sadly. And according to the CDO or the Chief Dental Officer in Tonga, he sees that there's a very high prevalence of periodontism. Now, one of the problems that has been encountered is when they see a dentist overseas to train to become periodontist or any other specialty, first of all, it's a long training program. Second of all, is many of them settle down in those countries and they don't return to their own countries to provide the service that was needed in the first place. So first of all, they've lost the dentists. Then second of all, they have lost the person who's supposed to help them out in specialty care. And of course, the long training program to become periodontist is also quite a daunting difficulty for many of these countries. Now, the current training systems for periodontology care or periodontal healthcare is based in institutions. And there's the definite lack of in-service training in these countries, which is desperately needed. So it's a common problem with all sorts of Pacific Island countries, and I'm sure a similar thing in what you call the Caribbean and in Africa. And you see, the Chief Dental Officer does a regular assessment of the periodontal treatment needs, and this is his basic concern. As like, for example, the Solomon Islands, dental officers here, Shorab, you got to help because teeth are literally falling out of people's mouths. So I told him that we're doing a test to research this whole thing in Tonga. Then once we test it out, then we'll try and introduce it to the other countries to get some form of level of care to the entire population. So there's a definite need to upskill local dentists to manage periodontics. So the aim of this whole research project was to fill this gap, the large gap, in terms of high prevalence of periodontitis in Tonga, and basically to review the literature that's currently available, and to ascertain the actual prevalence with a baseline screening of patients using the full mouth attachment level chart result, which is also used as part of the clinical management of patients. And also there's been no assessment of our health quality of life of Tongan, so that's something that we'll also pursue in our research projects. And then also to determine whether a professional development program for the dentist as part of in-service training will help upskill them and enable them to build the local clinical capacity that they desperately need. And of course, the research questions is asked as part of a research project. So you try and address whatever is relevant and necessary. And these are the research questions that have been brought to our attention. Now, obviously, the research project has been set into various phases. The 4 phases, and the essential part is obviously the literature review and to see what's available in terms of current available knowledge and where things are at, and of course working out the research project and the methodology in terms of what you call calculating the sample size, and of course getting human ethics research what you call approval from the respective countries. And thank God we did receive approval from the Ministry of Health Tonga as well as the Prime Minister's office to proceed with the project, and of course signing up the dentists as well as the delivering a modular professional development program to be able to train the dentists to be able to deliver a high level of periodontal health care. And of course, the phase 2 is basically screening the community, providing the treatment and the follow-up care in phase 3, as well as then collecting all the information and then basically analyzing it and then reporting it and sharing it with the rest of the global health community. Now, in phase 1, as I mentioned, we've covered this, and we've tried to use the Royal Australian Conservative Periodontology training program to help with our training. And of course, in the literature review, you always get the help of the librarian who's an expert in the field, and to structure the search terms to be able to sort of get the necessary literature that's available. So you set up guidelines in terms of what you want to really search for, and you always want peer-reviewed literature so that there's some facts, scientific basis, and of course in English language, so we understand what's written there. And we didn't want no abstracts and only studies that basically in Tonga or Pacific Islands, and excluding the protectorates of the USA and France, and also excluding Australia and New Zealand because the level of care is at a different level compared to the other countries. And the study year ranged between 1956 and 2019. And what we found was there was only 9 studies over the time period. Okay, 4 in Tonga and 1 each in Fiji, Tuvalu, Nauru, Rarotonga, Tokelau, and these are island countries. And we found there were 9 papers that were included in the review. And what we found is that there's a high prevalence of missing teeth in adults over 45 years age. And there is a rapid increase in the rate of dental extraction after 40 years. And periodontal disease is evident from a young age. And there's a community-based training program for self-oral care that was studied as well. And that periodontal disease in Fiji is a problem with advancing age. And 98% of the study sample needed some form of periodontal treatment. And 2% of the 45 needed a more complicated periodontal treatment. Tuvalu has got a periodontal disease prevalence across all age groups. And there's a definite need, but they don't have a resource. And Nauru has 90% of over 20-year-olds were all affected. And Puka Puka, which is near Rarotonga, and 45%, which is about half the population affected. And in Tokelau, the note, because at the time it was assessed, it didn't have proper assessment systems, but it was noted that periodontal disease was endemic in the population. So there's obviously a lack of consistency in the periodontal disease assessment methods, but nevertheless, it at least provides information in terms of the periodontal disease is prevalent in these countries that have been reviewed. So there's a definite need for screening the community for periodontal disease and to set up a professional development program working in, together with the Tongan team to upskill the dentists. And there's always a needs analysis, and this was provided by the dental officer. So he obviously saw a serious and urgent need for this study in a sample size of 394, which is not so difficult to achieve, and to include all the people over 80 years of age. And the treatment is fairly straightforward in terms of periodontal treatment. It's not too complicated. But obviously, the assessment systems which need to be learned. It may look very simple, but it's fairly complicated when you come to a whole holistic approach of periodontal health care and trying to include the medical history as well as the clinical findings and oral health care and the patient's ability to afford the treatment and providing the treatment, as well as the actual process of providing the treatment. Obviously, a full periodontal care is provided under anesthesia, and there needs to be very good post-treatment care as well as long-term bacterial control system in place for the patient to maintain good periodontal health for the future. And normally we do a post-periodontal health review, which is done 3 months after the treatment, so in some cases 2 months, depending on availability. And where the dentist advises the patient in terms of how things are progressing, keeps the patient educated, and if there's any refinement that's required. And then, of course, in terms of the research, they fill in the post-treatment, the oral healthcare review of the quality of life, as well as the dentist fill in the professional training program survey form. And of course, then you collate all the information. So this is very important to collate all the information. The methodology is very important. And the methodology is obviously tailor-made for each country accordingly. And there are difficulties and problems that each one encounters, but it is achievable. And of course, you've got to work out a secure form of storing data. Very, very important. This is the phase of cybercrime. and of course, analyzing all the results. And of course, the most important thing is to report to the dental what you call administration, the dentist, as well as the community and to the professional globally at large. And what is more important is then, when it comes to strengthening our system, is how do you then introduce this as part of public health policy? And this requires discussion, collaboration, communication with different stakeholders, and also empowering the public in terms of being able to get them involved and taking onus in terms of empowerment. And of course, funding allocation, and then analyzing and applying it, and then ongoing service. So strengthening health systems is an ongoing service. It's not that once you've strengthened it, you don't need to maintain it. It needs to be constantly monitored and served. So what we have here is just a sort of a summation of what we've been talking about. And the emphasis has been communication, collaboration, and teamwork, and dialogue. Now, this is very, very important, because without that and without sharing all this information, it's very difficult. And the role of telemedicine and teledentistry is really coming to the fore. And being part of the ER Health scientific group of the IADR, this is something we're fostering in terms of researching and promoting this, because then there would be a better distribution of expertise at a global level. Just like this, where I'm talking to my colleagues and friends in the Caribbean, where I'm giving whatever little knowledge I've got in terms of being able to guide them and able to achieve, especially periodontal health care capacity. But remember that this is an ongoing project, which requires constant monitoring, analyzing action, revision, as well as revising operational action plans, setting up strategies, and it's an ongoing evolving process involving the local academia, the dental health services personnel, the academia, as well as the community at large. Now, this is where it's important to what's next from here in terms of us in the Caribbean, the Pacific and the Caribbean. Now, the important thing to answer is there's always is, now what is in it for us, or what is in it for me? This is more so for the politician. Now, politician will help if he's going to see some output or some gain from this whole project. So it is important to understand your politician very well, especially the health policy makers, and then try and keep them in the loop of informing them, as well as in terms of what needs to be done for the betterment of the community at large, which we are all serving. Now, where to from here? I think this hopefully just ignites some information, knowledge to our colleagues who are listening to this, and seeing this. What do I have to contribute in order to be able to achieve this very important task of fulfilling the needs of our local community, as well as working as a team or teamwork for a global application. We can help each other in Africa. So it's time now, with better communication, improved technology, to be able to help each other out in various countries. And that too, not necessarily physically going there, but through internet and through various other modalities to be able to help each other out. And of course, we are all unified in the human family. And the importance of dialogue cannot be overemphasized, because the thing is this: it is essential to have dialogue, communication, collaboration, because to strengthen our partnerships and empathizing with each other and overcoming difficulties and problems and helping each other as part of a global family. Each and every human on earth is part of a family, of a global family, and it is all our responsibility. It is for nothing we are experts in our fields, or whether it's in dentistry, medicine, or whichever field, in terms of being able to look after the entire global family in whichever little way you possibly can, and to help each other out to achieve a common aim of getting health for all. And remember, we are all in this together. Now, in order for me to be able to deliver this, I must thank my team, and that's my advisory team at James Cook University, Professor Liggett, Dilip Sharma, Daniel Lindsay, who is my biostatistician, and Janet Cottrell, who is my librarian and ever the source of lots of information. for the support and guidance, and the most importantly, to thank Professor Arvind Santosh, the president of the IDR, who in his wisdom asked me and kind of invited me to be part of this webinar and providing a lot of support to be able to achieve this delivery. And of course, to the Ministry of Health and Prime Minister's Office in the Kingdom of Tonga for the negotiations and arrangements to test this out. And hopefully we will get some positive outcome to be able to help the people around globally. And of course, my Tonga team, which is basically the Chief Dental Officer, Dr. Amanaki Falalotu Pakapovi Kaitao, and the second in charge, Dr. Cecilia Kafita, and most importantly, Evie Clark, my practice manager, who will set up all the technical support system to be able to achieve this. So I'd like to thank you for your time and your listening to this and seeing this presentation. Unfortunately, this is a recorded message, and I've got my email address present in there. So it's just that I think at the time of your presentation on 9 December 2 p.m. it will be 5 o'clock in the morning here on Saturday here in Townsville. So Professor Santosh had said it would be best to record it so that just in case we have some communication issues or some problems, then at least we've got a recording of this presentation. Now, of course, there are references, which is a list, and hopefully we'll share this with you so that it's part of this record and you can refer to them as you wish. Thank you very much for your time and your efforts in this presentation. And thank you once again. So look after yourselves and stay safe. Thank you. Goodbye.
Thank you, Dr. Dr. Shorab. It's a wonderful,
thanks, Prof. Thank you.
Wonderful speech, which we definitely, I'm sure that everybody will be happy to listen to this one, right? So I'm happy that you're reflecting your research in terms of policy making areas, right? So I have a few questions which I hope you can answer, right? So let us say like a newcomer researcher or a researcher who is in their mid-career. What are your suggestions while we are doing a policy making research in terms of periodontal screening as well as planning for the management, right? So what are your directions that you give it to in general for any researcher in the world? Thank you.
Thanks, Prof. So initially there has to be personal interest on the part of the individual, and obviously to have some dental clinical background to be able to proceed with this. It helps to be, say, within a specialty, so you have more understanding of the specialty, irrespective of what specialty it is in dentistry or medicine or whichever field of healthcare there is. So what is of concern is many people are not sort of prepared to put in the effort to achieve this. But those who are keen, then the importance is to study health policy making, to study critical thinking, study communication, collaboration, and these courses are available, and they're not difficult to access because, in fact, it's available here in Australia. So you got to be part of a university setup, which is linked to the particular course, and it's a modular course. So they give you some idea in terms of the basis of achieving this, which is, as I mentioned and repeatedly, it's the importance of dialogue, communication, collaboration. By doing the course, at least you have some understanding about the technicalities of how to go about the process, overcoming difficulties. Because you see, any journey that one takes in whatever field there is, there will be situations where there will be obstacles and difficulties. And each jurisdiction and each nationality will have their own set of issues that need to be addressed. And the person has to be able to be a bit more assertive in a nice way and ensure there's a diplomatic approach and understanding the local culture fairly well. You see, some of the difficulties we do encounter in developing countries is that the political support is a bit limited. But you see, if you want to get into policy making in an active environment to achieve results, then you've got to understand who the politician is responsible, or the group of politicians are responsible for healthcare delivery, and educate them. many times, unfortunately, what does happen is the selective information that they want to achieve to primarily achieve their own political ends. So you've got to identify what clicks or what ticks for this particular politician. And then any politician who sees that they raises their profile in the community will then take up supporting whatever your tasks are in order to achieve welfare for their community. The other thing is, it's also very good to also include the local community leaders.
Yes.
Because finally, you may have a politician in government who is responsible for health policy, but at the end of the day, it has to come from the community. So community elders and community chiefs or whoever is in charge, senior people, they need to be part of your network or because they are stakeholders in this whole exercise. So establishing and getting to know them, inviting them to various functions or whatever, whereby we discuss these things. And as I mentioned earlier, many of these discussions happen over a cup of tea and some wikis, because that's when the people open up of what the reality is. So we may study something, read something, but we don't know the finer details about what is actually being, what is behind the scenes. But in an informal atmosphere, you'll get a better idea, and you need to get to the bottom of the difficulties. And sometimes it could basically be, there's no fuel for transport to go to the village. Okay, and then when you discuss that, then you say, okay, I can organize that for you. Or if you have contacts in the field, and they say, oh, yeah, we can give you the fuel and get you to the particular place. So these small, I mean, they may be little, but they're significant. Because if you don't have the fuel, then how will you get your vehicle to the particular village? Yeah, so these are things. So you got to think not only in terms of the big picture, but also the smaller things or smaller steps in there, in order to be able to achieve that. You see, and many a time, I mean, for example, I can relate this to you. Is in some countries, if you order a writing pen, it may take you 3 months to get the writing pen because of the technicalities of the approval list and bureaucracy before you can get it. Whereas if you just walked over to the shop, at the bookshop, you can get it for a couple of dollars, you know. So these are some of the things. Each country has got its own set of problems. So if anyone's interested in pursuing this, it's best to do it at a PhD level, because you need to investigate it locally according to what is actually needed. You see, and then you're researching it properly. You see, it's easy to, like, for me, I can go and sort of train people locally and do something, but then it is just me, you see. So, but if you do it the way that we are doing over here as part of a research project, the advantages is research, study it thoroughly, and then you have a better understanding. So when you're talking to the stakeholders, you have got some very good background knowledge and information and support. Okay, and like, for example, I've made myself available to the global environment of whatever little I can do in guiding and supporting whichever countries they are that need my help. And as I said, I'm originally from Fiji, and I know exactly what it's like to be in a tropical island country, and the difficulties we encounter in terms of transport and in terms of getting to places, providing services. So always try and identify people who may be able to guide you with the process. And it's not difficult. It's just dialogue like this, just having a chat and discussing a few things, and that's how we take it forwards. And if anyone wants help, and Professor Santosha knows about this, they can contact me, and then we can set up some projects. It's good to do it as a team thing, because you see, one individual cannot achieve this thing. You can't. There's a whole,
it's a chain.